Hi, I'm here to talk to you about testicular cancer because this month is Testicular Cancer Awareness Month. Now, testicular cancer only affects males and usually young males. The average age is about the age of 33, but it can happen anywhere from the ages of about 15 up into the 80s or even 90s. Now, there are two forms of testicular cancer in general, something called seminoma and non-seminoma germ cell tumor. The non-seminoma forms are more common in the younger men, and the seminoma is more common later on. But they're both aggressive, and they both need to be treated. So the question is, how do they occur? What causes them? Well, there's nothing that you did. If you have this cancer, there's nothing that you did cause it. And they can be associated with an undescended testis. So if you have a history of a previously undescended testis that has been corrected and has been placed into the scrotum, then that's certainly a testicle that you want to keep an eye out for in the future. So how do you do this? You do this by screening. Now, if you feel comfortable screening and checking yourself, we'd recommend that at least on a monthly basis, beginning about the age of 15, after a warm shower, after the scrotum has descended a little bit, you can fully examine each testis. How do you actually do the exam? I'd recommend going to the American Cancer Society website and they describe in detail how best to do the exam. You may feel things that feel abnormal to you, like a lump or a bump, and in fact, those are normal structures. If you have any questions, please talk to your doctor, particularly if something is new. Certainly if something's painful or it's swollen, that's certainly another indication you want to talk to your physician. So how do these actually occur? Well, it's felt that either while you're still a fetus or maybe as a young infant, in the primordial cells in the testes, there's an abnormal cell that develops. But it's not until puberty, when your hormones are changing, that something called the luteinizing hormone is increased. And that stimulates production of that abnormal cell. We think that's probably what causes these cancers. The incidence in the United States in 2023 is about 9,100. It will be 9,100 in 2023. The deaths from testicular cancer are about 470 a year. It's a very high cure rate. If it's just in the testis, there's about a 99% survival rate. If it's in the testis and the regional lymph nodes, it's about a 96% cure rate. And if it's elsewhere, say in the lungs and the bones and other places, it's still pretty high at about a 73% overall cure rate. So you want to get diagnosed early on if you have this. So again, I would recommend a monthly exam. If you are found to have a testicular cancer, there are CT scans that are done, and there are ultrasounds that are done, and there are blood tests. There's no biopsy done. Basically, you go to surgery and you have the testicle removed. Depending upon where the cancer might be, the cancer is staged. Sometimes we just do observation, or sometimes we recommend chemotherapy. It really depends upon the stage and the cancer you have. But again, those are very high cure rates compared to just 50 years ago when we didn't have the appropriate therapies. Most young men who had testicular cancer, in fact, did not survive. But now we have very, very high survival with testicular cancer. So just a reminder that as a young male beginning at the age of about 15, we'd recommend here at the Bighorn Basin Cancer Center a monthly testicular exam to make sure you don't have any new developments. And if you have any questions about any findings, we recommend strongly that you talk to your primary care physician about the next steps.